A very important topic, urticaria, is going to be discussed in this video. Hello dear students, myself Dr. Maddineni Srinivas, your dermatology faculty from Bharat. So let us begin the discussion without any further delay. So this was a question asked in the DNB examination December 2025 in the paper 2, test for diagnosis of chronic urticaria and how do you treat the urticaria in the pregnancy and cholinergic urticaria. So let us begin the discussion with the diagnosis of the chronic urticaria. Yes, chronic urticaria is that form of urticaria presenting as obviously the wheals which are going to be transient and angioedema or both for a period of more than 6 weeks, right? And diagnosing and managing the chronic urticaria requires a systematic history guided approach. So we cannot just like that write all the investigations which are available in our hospital. We should have a proper approach in asking the patient in the history, is there any infection or is there any injection history. So likewise there are so many other things which can be asked, but all of them are not going to be discussed in this video. But depending upon history, whatever the patient diagnosis could be possibly, accordingly we should be writing the investigations. That's the reason why the NB has asked this as a question, theory question, right? Extensive unguided laboratory testing is going to be utter waste. It is very low diagnostic yield and also it is very costly and it is discouraged. Investigations must be tailored to rule out any systemic disease if we suspect patient to have any systemic disease, or to confirm the autoimmune etiologies. Yes, in certain autoimmune diseases, patients may present with urticarial wheals and angioedema, and also to identify any inducible triggers. So these are the pointers according to which we must investigate the patients, right? So what are the basic initial screening tests which we can perform? So this panel is indicated in patients who are having this chronic spontaneous urticaria to exclude the underlying systemic pathology, any chronic infection or any hematological dyscrasias. So the most routine one is CBP with differentials. So what we can identify is if the patient is having any eosinophilia, then we should think of, is there any possibility of parasitic infestations, or is there any drug induced etiologies which could be producing this eosinophilia, or is it because of the atopic diathesis in the patient or in the family. We should ask about this. So that's why taking history is very important, especially in the case of urticaria, because everything below the sun including the sun can be the etiological agent in urticarial lesions, okay? And if there is elevated WBC count, obviously the patient may be having some kind of an infection which could be bacterial or viral infection, right? And also ESR CRP can also be done. These are going to help in revealing whether the patient possibly could be having any connective tissue diseases, or is there any possibility that the patient may be having the systemic vasculitis or any autoinflammatory syndromes or any occult malignancies. So these are all the things which could be identified with the help of ESR and CRP which are elevated. And also remember dear students, the patient may be euthyroid. So that is biochemically they could be euthyroid, but still they could be having the antibodies against the thyroid peroxidase and also thyroglobulin antibodies. So in such case, if we can identify this patient and if we give the thyroid hormone, then along with the thyroid hormone, it was observed that the patient, if they are having urticarial wheals, obviously we will give the antihistamines. So both are started at the same time, then the likelihood of the urticarial lesions to come down is going to be very fast. So that's why even if the patient is euthyroid, we if possible can also write this anti-TPO antibodies and also anti-thyroglobulin antibodies, anti-TG antibodies, right? And also the renal and hepatic function profiles can also be done, where there could be abnormality in the liver function, also kidney functions, because of which also there could be this pruritus, right? So we can identify this bilirubin elevation, transaminase elevation if we suspect that, especially in the elderly population. And fasting plasma glucose should also be done, because in diabetes it is usually observed that the threshold for the chronic pruritus, itching is going to be very, very low, and also there could be hive like eruptions in these patients. Now coming to the specialized testing. So these are not to be done routinely, these are only done if we have the suspicion of the patient having that particular disease. So autoimmunity, if you suspect, autoimmune urticaria if you suspect, then we can do this autologous serum skin test that is done in the patient, okay, or we can also do this basophil activation test, which is a in vitro test, right. So regarding this we can discuss in a separate video. Just here you can mention in this question ASST can be done. And in the case of urticarial vasculitis, where the urticarial lesions are persisting for more than 24 or even more than 36 hours, usually the urticarial wheals are going to be transient. They are going to stay less than 24 hours, right. But if they are staying for more than 36 hours, then definitely you should be thinking of urticarial vasculitis. Especially try to identify if there is any petechia purpuric lesions, ecchymosis with the help of the diascopy. And if you find any of them, send the skin lesion for biopsy, where you are going to see, because it is a vasculitis, we are going to see extravasation of the red blood cells, and also leukocytoclasia can also be seen because it's a small vessel vasculitis. We can also send if it is very much looking like urticarial vasculitis, complement levels can also be sent, especially C3, C4. And remember dear students, the hypocomplementinemic picture is going to be seen in two types of urticarial vasculitis. It could be hypocomplementinemic urticarial vasculitis, or it could even be the systemic urticarial vasculitis. So in these two conditions we can identify that there could be low C3, C4 levels, right. Next, if the patient is having angioedema without any wheals, then you can send the serum C4 levels as a screening test to identify if the patient is having hereditary angioedema. We can also send C1 esterase inhibitor, which is going to help us to observe how much quantity is there, and whatever quantity is there, is it functional or not, based upon which we can categorize the patient into different types of hereditary angioedema. We will discuss that in separate video, it is going to become lengthy otherwise. Next are inducible physical urticarias. So if you suspect the patient to have cold urticaria, then you can place the ice in a plastic bag and put it in touch with the patient. And after you remove this, we are going to see that on rewarming there is going to be development of the urticarial wheals. Okay, so please don't directly put the ice cube on the patient's skin, because if the patient is having urticaria because of the water, aquagenic urticaria, then without relation with the temperature, there may be urticarial wheals develop. So that's why you should put it in a plastic bag. Next is dermographism. We all know this. It is by firm stroking with the tongue blade or dermatoscope casing, or any back of your pen also. There is going to be linear wheals within minutes. Okay, it just says that the patient is having a tendency that mast cells are very, very unstable. There is degranulation releasing the histamine. Next is pressure urticaria. We are going to use the weighted challenges in this case. Okay, so 7 kg weight is applied on the shoulder, thigh for a period of 15 minutes. Next is most importantly the infections and also any dietary trigger. So for this patient, we can encourage the patient to maintain a diary, and every day the patient, they have to write down whatever they are eating, whatever they are coming in contact, any perfume, everything in a day, whatever they are coming in contact, whatever they are eating, especially outside food if they are eating. So everything they have to note down, and also write down are they getting wheals on that particular day when they are eating any specific food. Okay, how many lesions are there, how much time they are staying, with what the lesions are reducing, and after how much time they are reducing. So everything the patient can write down, so that on the next follow up when the patient comes, they can bring the diary and we can just have a glance and look at any possible triggers which could be producing the urticarial lesions, right. And also the coming back, Helicobacter pylori screening should be done, because if you identify this, if we eradicate, then it could lead to complete remission of the chronic urticaria. And also stool examination can be done. For example, if you remember eosinophilia, if it is observed, then we can send the patient's stool for examination to identify any ova or parasites. Pseudoallergen free diet trial. So this could also be done for a 2-week period. There's we have to restrict certain dietary preservatives, colorants, and also salicylic acid. So that's it in this video, students. If it was helpful, please do that like button, and if you want more such videos on a regular basis, put in the comment section. Thank you, sir, so that I will get motivation. And also do subscribe this channel if you are not yet subscribed, and also do hype this video if it was really helpful. Thank you so much. Happy learning. We'll meet again in the next video soon. Bye bye.